I'd like to call this meeting to order for the regular session of the Blackhawk County Board of Supervisors for March 24, 2026. Roll call, please.
Schwartz.
Here.
Kurtenbach.
Here.
Hall.
Here.
Brandt.
Here.
Leyland.
Here. We're going to take one more quick moment of silence since we've already had one early this morning. We'll take another to reflect on our actions today. Please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 1, agenda received as proposed as amended.
So moved. Second.
All in favor say aye.
Aye.
Opposed, same sign. Item 2, public comments. Is there anyone in the audience that would like to speak on something that is not on today's agenda? Anyone online? Right, moving on to item 3, claims and payments. This is a resolution that the Board of Supervisors approve expenditures and that the county auditor be authorized and directed to issue payments against the various settlement of such claims as allowed.
So moved. Second.
Ms. Wiener.
Good morning again, Board. Our total bill payment today is $393,664.70. Out of that, from the 60/40 fund, we're paying $4,160.30. And we have one construction payment being made on the Pinecrest Health Department renovations for $88,931.64. Everything else is pretty routine. Everything appears to be in order.
Any questions for Michelle? This is a resolution. Please answer as your name is called.
Brandt.
Yes.
Hall.
Yes.
Schwartz.
Yes.
Kurtenbach.
Yes.
Leyland.
Yes. Item 4, receive project updates from department heads and elected officials.
Good morning, Board. Kathy Nicholas, County Engineer. Just a brief update on what's going on in the roads department. We are getting busy with some of our early spring activities. We're taking off the wings off of our tandem axle dump trucks so that we can start hauling some spot rock in places. We are taking off a few spreader boxes. In the next few weeks, we'll be moving on to taking off the front plows, providing we don't get any more snow. So taking the front plows off, of course, we'll be getting busy with that in several more weeks. In other news, I wanted to let you know that the Iowa Department of Transportation is tentatively planning to host a meeting on April 15th to discuss, this would be a public meeting to discuss the Highway 63 and C57 or Cedar Wapsie improvements at that intersection. They're tentatively setting it for April 15th, and it would be, I don't know a time yet, but it would be in the late afternoon, early evening at the Denver Community Center. So I'll be sure to let you know. I know the DOT will have some information on social media, and we'll be posting that on social media as well. I have a large percentage of people in the north portion of the county are concerned about that intersection, so we'll be sure to let you all know when sure that takes place. Can I answer any questions at this time?
Got one for Kathy, and 5 p.m. is what we were told for that meeting, and it was Denver Library is what we were told at the.
Okay, yeah.
I was at the Lesser Township meeting last night, and they were asking about, apparently in Bremer County has blue signs in the Amish areas where they have small businesses and stuff out in the rural roads. Is that something that's available to our folks here in Blackhawk County as well?
That's a good question. We haven't had that request, but I will follow up with you and follow up with Bremer County to see exactly what those signs are. I'm not familiar with those types of signs.
Yeah, it's out in the Amish area. There's,
Okay.
it's where it was pointed out, and I remember seeing them. But they asked if that was something that the Blackhawk County had available. I didn't know, so just
Okay.
like
Are they provided at no cost or something?
don't know.
Oh,
I think some of those, because I go up in the Amish area a lot buying plants and stuff. I think a lot of those might be even on private property, maybe set back a little bit, but because they're not, a lot of the ones I'm familiar with aren't like traditional roads. road signs. I know some other counties, like, maybe Winnesheek will have signs pointing to like Seed Savers Exchange, for example, or something, so. But those ones look like more official road signs.
So, just bring it up today and ask.
Okay, so well, I'll check it.
Okay.
Thank you.
Any other department heads or elected officials?
Yeah, I know, which is fine, or who's gonna go next. Caitlin, I'm the Public Health Department. I do have a couple of updates for the board that are impacting our operations currently. It's a little bit of a history to it, but in early March, the Iowa Department of Health and Human Services terminated a contract with New Era Pharmacy. This has been in the news. It's not been in our local news, but it's been in the Des Moines metro area news for a breach of contract. And so the breach of contract, what's been reported in the news involves lack of a reimbursement to Iowa HHS from New Era in the ballpark of $22 million. That $22 million is used to be reinvested into public health programs, including STI prevention, HIV treatment programs, and immunizations, and tuberculosis. So we're starting to see the impacts of that termination of that agreement trickle down to local public health. Because Iowa HHS reinvests those funds back into programs, that includes several contracts that we hold with Iowa HHS. It also includes actual medications that we receive through the 340B state purchasing program for medications that we give to individuals that test positive for reportable STI infections and also tuberculosis programs. So right now, the Iowa HHS has prioritized certain populations that they're asking us to use 340B meds that we have on hand. And then lower risk populations, essentially we will not be case managing anymore for tuberculosis, for example. So if they do not have active TB disease and have insurance that can cover that, then we are not case managing them. They're getting the medications on their own and not reporting back through public health. In my opinion, that's not best practice, but that's what the situation is allowing or kind of mandating to happen at this time. We also have 340B meds in our clinic that we administer to people with STI infections or partners of STI infections. We're also prioritizing those to high-risk individuals or individuals that don't have coverage for any other means at this time. We are working with the state to get regular updates and hope to have an update as soon as a couple of weeks on kind of where the situation is with the medication program. It's my understanding they are working on an emergency contract with another pharmacy institution to be able to continue the medication, 340B medication program. However, contractually, we're seeing direct impacts and indirect, well, they're all direct impacts. Contractually, we were notified by Iowa HHS that we're no longer going to receive incentive funding for TB directly observed therapy. So essentially what that means is one of our nurses does case management with active TB cases to ensure they're taking medication as instructed. This is an evidence-based practice for making sure that individuals come to completion, no longer being communicable, as well as avoiding drug-resistant tuberculosis. So we're not receiving the incentive funding for that at that time. They are expecting us to continue that practice. The other contractual impact is that yesterday we were notified by Iowa HHS they are terminating our contract as of April 15th for disease intervention specialists and partner services for STI, which allows us to follow up on communicable disease investigations. Communicable disease investigations that we follow up on are reportable under Iowa law and are required to be followed up on by either county or state. And we do those at the county. So that contract for FY '27 is about $50,000 that they are not anticipating to be reviewed for FY '27. So, unfortunately, I don't have good news for you right now, especially coming off of the property tax hearing that we just had, but we are working every day to mitigate the impact to residents on what's happening at IOHHS that is then trickling down to us, and coming up with contingency plans of how we're going to make sure that our community members are still served through these programs. Do you have any questions for me?
Yeah, Caitlin, are we still leading the way with STD rates in Blackhawk County?
You know, offhand, I don't know where our rate is compared to other counties currently. I know we continue to be kind of at the top of the list. Partially, it's because we have a very concentrated population of young people in our county, so that's one of the factors. Also, just kind of this system of how STIs spread, you know, we just see that in our community. So I can get back to you on where we're at with rates, you know, compared to all other counties. I just don't have it off the top of my head.
You don't have to do that, but where would I look to save you the headache of doing it?
I'm actually not sure if it's published, so that's why I need to look into it. Yeah.
All right, and then when you talk about case management for like the TB cases and things, what all does that case management entail?
So, kind of two things. Individuals with active tuberculosis, meaning that they're infectious to others.
Mm-hmm.
That's a very intensive case management process where our team works with them to identify who might be exposed, kind of how we do communicable disease investigations in general, but working with them on who might be exposed. So there's a contact investigation aspect of that to make sure that anyone that's been exposed, has the opportunity to get prophylactic medicine, and then regular testing to make sure that there's not been a conversion into like a latent disease or something. And then also because tuberculosis is a very long-term disease to treat. You know, we're 6 months or long, 6 to 9 months, or if you've got a complicated case, it could be up to a year of treatment. Our team works with those individuals to make sure that they're taking their medications. Sometimes it's through video DOT, so they just record a video of themselves taking medication, and sometimes it's an in-person visit. And so that's what I'm referring to with the case management part of it. For individuals that have tested positive, that they've been, you know, they have the TB bacterium in their body, but it's not causing them to be infectious to others. We also have a less intensive case management program where they're seen by a provider, medication is prescribed, and then we meet with them to kind of go over the medication, and then on a monthly basis check in with them to give them more medication to ensure that treatment is complete. That's a shorter course of treatment than the active diseases, but it's still a lengthy course, several months usually.
Okay, so with the funds are getting cut, is that what I'm interpreting here? And that's for into the foreseeable future for good? We just don't know.
The contract, the regular contract is set to reopen in July or August. So like the regular period that IOHHS would enter into a contract with their 340B medication provider. So it's up to July or August that the medication disruption could happen, but like I said, they've told us they're working on an emergency contract with another pharmacy, so it isn't until July or August. It's restored.
On the health side, does this have the potential to be pretty impactful in terms of local epidemic?
I guess, to be quite honest about it, the impact is a shift of financial responsibility from the state to the county level. That's an impact.
Okay. That's what I was getting at.
Maybe you should have spoken in the budget session hearing.
Well, they're still here, but yeah.
I just mean, it's just that those types of things that it's really kind of difficult.
Any other questions for me?
I don't mean to keep throwing stuff at you, I'm sorry, but in terms of like dollar wise, what do you think it would take, maybe that's not a fair question right now, to help you guys continue administering?
Nothing, no.
Okay.
Yeah.
Thank you.
Caitlin, quick question.
Yeah.
Do you guys have a calendar date set up yet when you have the mobile clinic out in different areas yet?
We don't, but it is something we've been discussing internally. So as soon as we have identified some dates of things, we'll make sure we get that out, and we'll work with Gabby in getting that out as well.
I just got asked that the other day, and I was like,
Yeah.
I thought
Oh, good.
I'll ask. Somebody's asking.
We're asking about it, yeah,
Yeah.
that's great. Thank you.
Thank you.
Morning.
Morning.
Amanda Fesenmeyer, HR Director, and I'm just gonna get up here and say this because I accidentally hit send on a GAPM survey to like all the managers, department heads, and supervisors, but not a big deal, it just was a little unfinished, so really quick. So yeah, you're gonna get 2 emails from me, but just a reminder, our GAPM survey closes this Friday. Lynn and I and Al actually just got an update from the consultant. We're at 207 responses, which is 54%, which is, you know, we would have liked to have been higher. When we did this a year ago, we ended at 68%, so I'm really putting a lot of accountability on leaders, managers, elected officials, supervisory staff to say, ask your staff to, you know, have they completed it? Have you yourself completed it? So we're trying to lead by example, but also remind them while it's anonymous, it's not really optional. Okay, we need everybody's feedback for this GAPM in order for our culture team, as well as the county, to work on our areas of weakness to improve and build on our strengths. A lot of questions that we've been getting on that is, you know, how's this going to be used? Is it really going to matter? Well, we don't have the voice of our employees. It's hard for us to know what to necessarily work on, but I think we're already seeing that change even from a year ago. But just remember that, you know, encourage your staff to complete this. Your voice does matter in these types of surveys. I think this is the only time I can recall we've ever done a countywide culture kind of workforce survey across everything, especially when it comes to how we work and how we, like, what culture feels like here. So with departments, in looking at a department GAPM survey, that's likely coming in the next cycle potentially. But that's great that we're even being asked that by staff to kind of focus more on, well, what about within our department and our culture. But right now, again, we're trying to focus on the unified culture across the county. So you can read my multiple emails, but just again, reminding that all supervisory staff, managers, elected officials, that take it upon yourself to ask your staff if it's been completed. Again, we're not asking you how to tell us how you responded. We're just setting the clear expectations that everybody needs to complete this. So I will note that the email that has gone out, I only went out to employees that were hired as of March 2nd. That was just, so if you do have new hires, you can just send them their link directly. It potentially could skew, maybe we'll have over 100%. That would be the best outcome. But again, we've only hired just a couple in the past week. So, but if you had an employee come say, hey, I didn't have that email from the survey GAPM.com, it's possible because if they were hired after 3/2 that they didn't receive the email, you could just forward them the link. So, any questions on GAPM at this point? We could all raise our hands, see who's done it.
Do you want us to do it too?
Yes, yeah. Yes, so the only thing you wouldn't do is the 3rd section, and same with department heads and elected officials, which is rating upper management. So staff, supervisory staff, manager, anybody who isn't a department head or elected official is going to complete the full survey, but if you're in the department head elected official role, then you would just do 1, 2, and then leave 3 alone, and just hit submit, and it will work. I've done it. So, all right, thank you so much. Any other questions on that? All right, hoping that we're gonna get another, whatever percent that would be to get to 100,
Yeah.
so.
Beat last. Yeah.
Good morning, Gabby DeWitt, Marketing Coordinator. I just wanted to keep accessibility, digital communications kind of in the conversation. We did have a website committee, web accessibility meeting last Tuesday, and I believe about 38 staff members attended. Next Tuesday, we will be holding, and this is with our vendor, AccessiBlue, we will be holding a accessible documents training, and it's virtual, so we do have space if people listening or if you all would like to attend it. Making your documents accessible is probably the biggest challenge as far as the things that you share, because email is included in this digital communications mandate by the Department of Justice. That said, I've heard a rumor that they may be rolling back some of those DOJ criteria or rulings, so we're keeping an eye on that and we'll know, and our vendors suggest that we probably won't know till the week that we're supposed to be compliant. So we're just gonna keep on keeping on, and actually it's the right thing to do, right? We want our information to be as accessible as possible. And I know at least for me, and I think the people who are working with it closely, we are learning quite a bit. And so now we're in the process of kind of looking through our web content and things that we can do to make those items more accessible to all. And we'll just kind of keep working on that. It's not like you have to be 100% compliant by April 24th. You just have to have a path to compliance, and that we do. So just wanted to give you an update. And if you want to attend that training, let me know. I'll send you the invite. We also have a training or conversation really coming up with Mike and our vendor on legal, like how to respond to claims. And then we will be later having a training on social media and also making maps and charts better accessible. Any questions?
Thanks, Gabby.
Thank you. Is anyone online? Moving on, item 5 is minutes approved of March 17th, 2026.
So moved.
All in favor say aye.
Aye.
Opposed, same sign, minutes are approved. Item 6, consent agenda. The following items are acted upon by single resolution unless someone wishes to pull one to discuss.
So moved.
Second.
Roll call vote, please answer your name.
Hall.
Yes.
Kurttenbach.
Yes.
Brant.
Yes.
Schwartz.
Yes.
Leyland.
Yes. Item 7, contracts and agreements. Resolution to approve the contract with Pathways Behavioral Health Services, Inc. for the Too Good for Drugs program for the period through June 30th, 2027, funded with opioid settlement funds, and the chair to sign as submitted by Michelle Weidner, Finance Director.
So moved.
Second.
Michelle, did you want to
This is, I think, just pretty routine now for the contracts that we awarded a bit ago.
Any questions for Michelle? Please answer your name as well.
Can I go back one step? I apologize.
I'm sorry.
Who did the motion in the second for the consent agenda? Or I can go back to the recording.
I moved on the consent agenda, I think Justin maybe.
Justin.
Second.
Yes, yep.
Thank you. Okay. Hall.
Yes.
Schwartz.
Yes.
Brant.
Yes.
Kurttenbach.
Yes.
Leyland.
Yes. You got 7, covered, got that one done? Okay, super. Moving on, item 8, other business, resolution to fix the date public hearing, that's all right, as April 7th, 2026, for the authorization of a loan agreement and issuance of not to exceed $1 million general obligation capital loan notes of Blackhawk County, State of Iowa for essential county purposes, and providing for publication of notice hereof, hearing ECP-1 as submitted by Michelle Weidner, Finance Director.
So moved.
Second.
Any comments on this one, Michelle?
I would say this is for the optical scanning voting equipment that we need to replace, and it's just part of the process so that we can levy the tax and get it in our budget at the appropriate time.
Thank you. Please answer as your name is called.
Kurttenbach.
Yes.
Schwartz.
Yes.
Brant.
Yes.
Hall.
Yes.
Leyland.
Yes. Item B, resolution that the letter of support for the Northeast Iowa Food Bank's request to utilize New Markets tax credit financing for its planned expansion and renovation project be approved, and the chair directed to sign the same.
So moved. Second.
Barb, did you want to speak to it at all? I was going to say.
Yeah, I'll be brief.
Oh, oh, thank you
I
very much.
promise you I will be brief.
Thank you for patiently waiting through.
Oh, no,
Thank
it's,
you.
it's all good. 2 things, just want to give you an update. So since we met a month ago, our team is working on a strategy to reach out to other jurisdictions for funding. It's a work in progress. It takes time to meet with everybody, so just know that that is still working. New market tax credits are an avenue that we're exploring and likely going to be applying for that will really boost our campaign. We have the potential of getting between $2 and $3 million through this project, which will help, one, diversify our funding, but also get us over the end goal of paying for the project. and ensuring that people in Blackhawk County and beyond have access to nutritious food. We can't do what we do without community support, and this letter will help gather that community support and that funding that will help push us over the end. So if you have any questions, I'm happy to answer them. Was
there any continuing responsibility with the letter then that covered this?
No, not at this time. You're just saying that you're supporting the project. You're not obligating yourself to any funding at this time or anything, no.
And you said that 2 to 3 million, there's a potential for that, but is it?
It depends on, the new market tax credits are very complicated. We're working with creative planning to put the proposal together because it's like so far above my head even. But it helps, it depends on the size of your project and how much cost you can put into that project ends up with what you get back out. Last year in the Big Beautiful Bill, there was $10 billion appropriated for it. It goes out to communities to help projects like ours get over the end line. Food banks across the country have over the years used it, some getting as many as $30 million in new market tax credits. So it's just an avenue that we're exploring. Likely, yes, it does cost us money, but in the end game, it helps your community grow as well and be vibrant and all of that.
Is there a timeline you have?
I believe that, we're like moving through the process. Overall, there's a 7-year timeline for what our obligation is on the end of it, but the application will likely go in the next 2 months. It's pretty fast. Yeah, it's pretty fast.
Thank you for being here, and yes, said your patience and hearing and all to explain. So thank you.
I just want to say while you're here that I really appreciated the post about National Ag Day.
Oh, yeah.
That was celebrating all the local farms and farmers that you've got partnerships with. And it really highlights a part that I think people miss a lot when they think about feeding people is that there is this economic development part of it. Those are all dollars that stay in this community and circulate around over and over. And so just really appreciate that you've always been a leader in that realm across the state.
So probably 10, 12 years ago, we started working locally with Hanson's Dairy. And it's just expanded from there. When the federal government appropriated the local food assistance program funding that was available, we really utilized it, but we've consistently over the last 10 to 12 years used private dollars to invest in our community to get good nutritious food, help the local economy, and ensure that people have good food to eat versus spending money to truck food in from around the country. Choose Iowa is a big part of that. The state of Iowa puts up $200,000. Food banks match it. Our portion of that is $34,000. So $68,000 altogether will go back into that program. But beyond that, we're spending hundreds of thousands of dollars on local foods annually to ensure that people have access to food. Yep. Thank you.
I was going to say, Barb, too, you wanted the letter. I know by tomorrow we'll take our vote and see if that's approve that letter of support and hand this off to Dick. You want to stay another minute?
I can. Thanks.
Any other questions for Barb? I assume no?
No.
This resolution, please answer your name is called.
Schwartz,
Yes.
Brandt,
Yes.
Fall,
Yes.
Kurttenbach,
Yes.
Leyland.
Yes. Do you want it now and have me
Yeah.
leave? Because I was going to say, I know you've been patient.
It's all good. I always learn something. Thank you very much.
Thank you very much. Item C, resolution to approve the letter to Marco Technologies and authorizing the board chair to sign the same to request remediation of deficiencies in boardroom audio visual system.
So moved.
Second.
Morning, Board. LU IT Director, just here to answer any questions you may have.
I don't think so. I was gonna have a question for Mike. I was gonna say, because we were talking about some of the things that we were expecting a response from them, I wondered if we should send a certified letter? Or no?
Won't hurt to send it certified, they'll probably get it either way, but
Oh, I
if you
know
do
that.
send it certified, I would send a second one regular.
Oh, send both, okay.
Send
I don't
both.
know. It's
The reason I say that is sometimes certified mail for goes unclaimed for one reason or another. It's kind of a belt and suspenders approach.
Well, does that work for everyone? I mean, as far as the doing
I
that,
would
I
agree.
just was just gonna ask about it. All right. This is a resolution, please answer your name as well.
Kurttenbach,
Yes.
Grant,
Yes, as long as the format changes from what I'm seeing. Is that what you saw on that?
Oh,
This would be in our letter.
here's what we got.
Overlapping things and it
It's
looks
one
like
of those
it's.
where, yeah, this is how it looks right now.
Alright, yes.
He's got one of the things like Michelle had the problem.
I wanted a clean yes. so-
Yes, clean yes.
Hall,
Yes.
Schwartz,
Yes.
Leyland.
Yes. Item number D, resolution to approve the opioid litigation 6 remnant defendants settling with Associated Pharmacies, Inc., the American Associated Pharmacies, J.M. Smith Corporation, Morrison Dixon Company, LLC, Louisiana Wholesale Drug Company, Inc., North Carolina Mutual Wholesale Drug Company, Inc., and United Natural Foods, Inc., and SuperValue, to authorize the board chair to sign the combined subdivision participation and release form for same, and to authorize the board chair to sign any other settlement documents related to the 6 remnant defendant settlement in the opioid litigation.
So moved.
Thank you, Mike, for that resolution.
Yeah, it's, and I do not know the amount of this yet. The rep over at Kruger Dickinson did get back to me when I emailed her last week, said she'd try and find an amount out. She thought it wouldn't be that big. These are relatively small players in the overall litigation. But in any event, it's not something, while we have to pass a resolution to receive our share, it's not something where we have to really negotiate our share.
Any other questions for Mike? This is a resolution, please answer your name and call.
Schwartz,
Yes.
Grant,
Yes.
Hall,
Yes.
Kurttenbach,
Yes.
Leyland.
Yes. Item number 9, legislative update. Discussion and possible board action to approve position statement on pending legislation.
Just a quick update, last week there was a debate on the House bill for property tax changes. One of the major concerns is the limits they're talking about putting on our reserved and unreserved dollars. The concern is that also affects our bond rating. I was gonna have Michelle maybe help educate a little bit or explain somehow how that works.
Okay, yeah, so as we understand it, the House is considering language that they want to restrict our general fund, unassigned fund balance. So that's truly your fund balance available to 35%, which is, while a dramatic increase from the governor's previous version, I went back and pulled our Moody's rating from last May, and under the section about factors that could lead to a downgrade of the rating, a substantial weakening of cash and fund balance below 50%. So I did share this with the UCC group, who may be sharing it with certain legislators at this time. Sounds like they saw what they perceive as a lot of cash flying around all over the state, and could use it to reduce your taxes, but I don't think they have a full picture of how entities use reserves or what they need them for, so hopefully we are educating them on that, so we'll see what they come back with. Still soon in that process.
The other concerning bill was there's a IPAC bill deals with our ability to invest dollars that we have. The bill right now is, I would say, stalled, but it is still eligible for action. There was several of them, we thought there might be more of them that were killed off in the second funnel that weren't. And then there's a couple of them that are slowed down, but they can still be brought back up. So there's still concerning, there's still a lot of movement and action happening. So still reason to be quite concerned with what's going on down there. we have not been asked for any statement yet, where we stand in any of the bills. This past week, we've been kind of waiting for more direction where they want us to be making some decisions.
I'm not sure where that'll go either, it's just pretty fluid every week as you can guess, so. As things move. Thank you, Rich. Item 10, work session, discussion, possible board action and considerations of all aspects of the fiscal year 27 county budget. I think you provided all the paperwork for today was for the hearing, correct?
Yes, I did not provide any new paperwork for today because we haven't changed any decisions from what I provided for last week. If there's anything we looked at last week that you'd like to discuss, I am happy to do that, assuming my computer chooses to play ball with us now.
Well, and I was gonna say, I mentioned, well, some were not yet here in the meeting, probably in that intermission that we had. I wondered what the board's thoughts are if we maybe try to, our goal being maybe to try to finalize any changes or review the decisions we made. If we want to make any changes, to do that next week. Not that we can't extend that time period, but that be our goal, to kind of make as much progress as we can on things next week. If that works for everybody, to try to make that be a goal number one.
Yeah,
Moving maybe, but.
Yeah, if we can do that, then I think I can incorporate whatever adjustments you've reached consensus on before we publish the rates and the actual expenses by program for the adoption hearing. That's about a 3-week process, so I think you would be looking at having our actual budget hearing that week of April 20th. Probably the earliest would be that Monday, April 20th, and then it also could be later that week. I prefer to get it done that week just because we have to be finished by April 30th, and that's mid the next week, so it does.
Gives us a backup.
It will give us yes, there is a backup if something goes haywire with publications, as sometimes happens, but yeah, I didn't want to push it right up to the wire in case something happens there.
And making those decisions, you say, next Tuesday for the most part.
I think, yes,
That-
I would say whatever choices you can agree on next Tuesday is what I would incorporate in the published notice. And again, as you know, you can always reduce from there if you need to.
And you mentioned something yesterday, when I said that in that packet that we'd gotten last week, that everybody had this one, I said, is everything that we need to make these decisions going forward? And you made one comment, and I didn't go back and check on it. You said there was one document that had questions on it for us.
Well, yes, I'm sorry, I did forget about that last night. So there was, at an earlier meeting, we had talked about some things that really aren't included anywhere in the budget yet. I don't know that I remember which meeting, but I'll look.
No,
I do know one of the items on there was future renovations, like how do we make enough room for the attorneys? That's probably the only thing that's left on that list, I think, that I recall off the top of my head anyway.
And I'm not saying, didn't mean for you to have to, but I just thought if we could have whatever those questions were, if there was something that was gonna help us get to where we need to get to next week, or anything else you think of, or we think of, that we wanna ask for, but otherwise we have to answer that.
I think most of, there can always be other ideas, right, that we
Sure.
haven't discussed, but you've got the budget adjustment worksheet that's got everything we've talked about. I think we're up to maybe 40-some now suggestions. One thing that we have not done is finalize use of fund balance, so that is a choice that's still out there.
Yeah.
And I believe
Those
that's all.
options, and you mean those options, that sheet you had the options on, the 8 or 1 through 9?
Yes, and I was just trying to give you ideas of if
Anything
you,
else?
if you use this much, this is what happens to the tax rate.
Thank you. So I just thought to think of anything earlier the better for us to have time to think about it this week.
While we're on that subject, Michelle, the sheet we got from last week is dated 3/17 with.
The budget adjustments,
Yeah, the rural basic is still showing, is 143, 164, is that we over on that number, or we still need to come down on that to get the zero?
That's, well, we're removing that to the rural supplemental right now.
Okay.
So technically, the rural fund is, it's not over its cap, but only because we're using the rural supplemental.
Okay.
And I think it might be in our best interest to have some small amount of rural supplemental this year.
Okay, yep.
Because otherwise that might not be an option.
Yeah.
The bills, some of them have some interesting wording about being able to use levies, so it's unfortunate, but they're.
Again, one of those legislative changes. that
Yeah, they're
could
not
hit us
understanding what
by
they're doing,
what
but,
they're doing.
yeah, exactly.
Could we entertain having that meeting next week at 4 o'clock or in the later part of the day?
A budget work session, or are you?
Yeah. And if we're gonna make decisions, get down to the, I guess, to the end here, in case more people do wanna come. And it would be horribly inconvenient for me, but I'd be willing to do it.
On Wednesday? First?
What do you think?
No, the 31st,
31st.
next Tuesday.
What I'm afraid is, I definitely want staff to be able to be there. That was always a concern, that for their budgets or changes that we ask or things that we ask them at the last minute for some of the changes we could make to theirs. So it has to work for so many more than just us. So to do it quick like that, I know that you mentioned having meetings other times too, maybe doing that.
Well, I know at one point last year, Rich had brought up, the cost incurrence of having it, which I don't think would be much. And frankly, I don't think it matters at this point if we're worried about cost, considering where some of our spending priorities are going anyway. But I think it would just make sense to have this in the later part of the day so more people can be present and vocalize thoughts if they wanted to. So if, do I need to make a motion to do
Well,
that?
I'm trying to think.
31st.
I was trying to think.
31st would, I just have to,
If that doesn't work.
I just have to cancel, I'm presenting at UNI that afternoon and evening, so be
Or we can find
be
a
an
different-
adjustment on
a
there for
different day
sure.
too.
Well, I was wondering, I'm trying to think of not just not having the one, this is just off the top of my head, he's throwing out here again. If we could still have it, but if we could do something kind of like a session, a work session or something to allow people to have a voice or come and speak to us about things, or is there something particular, maybe you think a subject or just about where our budget, kind of like we did today, even that type of.
Yeah, I mean, I think similar today, and if next Tuesday doesn't work, we can also find another day in the week or the following week. I would like the opportunity for people, just some of the comments resonated with me.
Yeah.
And some of the folks.
Well, I was just thinking kind of a listening post thing, like at least that you'd have that information and you could take it to the 31st. Of course, that puts us doing it this week, but any particular days you thought were better than others? I know it's not gonna always work for us, but it was just like if we could pull something and allow them to have the opportunity to speak if they wanted to. I don't know. Thoughts, comments? From a staff standpoint and the budget standpoint and us making decisions, I guess I like it on the 31st, to just keep in kind of where people come in the courthouse and that type of thing, not changing it too much, but
Right, because
I want people to have a voice.
if that, I won't be able to get it done for the April 20th hearing if it goes
And pass
2
the
days
31st.
after that, there just
Okay.
isn't time.
Yeah, we've gotta do the public.
So
Got it.
What would
moving it
Monday?
up would be better than moving it later. So like Monday would be
Like
better.
Monday evening.
Would Monday work?
No,
Doesn't,
Monday does not.
what are your thoughts, guys? I was gonna say otherwise, I'm not trying to beat it, something that's not, but I just know if there is a,
Later this week potentially?
I don't know, that starts to get tough too.
I know.
Yeah.
And
Other than
unfortunately,
Friday afternoon, I'm not the rest of the
What'd you say?
other than Friday, the rest of this week, I'm gone until Friday afternoon.
I can't do Thursday or Friday.
You thinking 3 or 4 o'clock? 3:30, or?
Yeah, whatever, 3:30 could work too. I thought 4 would make sense for people, most normal people who are working 8 to 4, roughly, if they wanted to attend.
Would it be worth doing something like I'm still just thinking out loud here, like the hearing presentation you presented today, to do something like that for a group, like Monday night, or what day were you thinking worked best, even if it was this week, but I'm finding the date, but I just meant to do something like that and then allow them the opportunity to speak like these people did today. Would that be fine?
Yeah,
Let's
I mean,
make the decisions.
I guess I was just thinking it's similar to today, just another opportunity before we have to set things in stone.
Because then have our meeting on the 31st still, hold
Well,
that.
I would say, even having the meeting on the regular meeting on the 31st, making the decisions that we think we wanna make, we could still go down from that even by the 20th, correct? We're not set in stone on the 31st, that's the lowest we can go. That would
No, what we talked about is, that's what will get published.
Yeah,
Correct.
Because I have
So we
to
can
know-
still come under that number if
Yeah,
there's a
you can
decision.
do that, clear
desire to
up
do
clear
so.
up to the
hearing
day.
on the 20th if you.
So I'm just saying, I say that just to say we don't necessarily have to cram it into the next week if we want to look at the 7th or the 14th, if Tuesdays feel like the right times.
Doing it after.
Yeah,
And I would suggest that maybe we do it in the Pinecrest Chapel, if there's more room.
Is there, yeah?
We gotta have all staff go there though,
Just for an evening.
Oh, just-
For this.
for the work, kind of like a work session, I
Yeah.
guess. We're not gonna,
it would just be a work session at that point.
I like it, I'm willing.
Cause she said it, Pinecrest?
Yeah.
chapel, I was thinking.
Okay.
So what's our date, or what are we thinking for a date and time?
Can the,
A work session only, so staff wouldn't necessarily have to be there.
except for Michelle.
Oh, yeah. Well, she
Hey, Karen.
Karen. She doesn't have choice.
Probably Mike.
I was gonna say, it
Karen.
depends on the day. For me.
Yeah.
I am out of town.
Can I suggest maybe
Out of town.
maybe we do a doodle to see what time works, as opposed to
Sure.
trying to line up schedules sitting here, but if
Yeah.
we have some general consensus, then
Yeah.
we're open to doing
I'd
this.
say-
So I'm open the 7th that afternoon.
I was gonna suggest April Fool's Day, but I thought that might be.
Yeah.
Okay, but doodle poll will be fine, let's come up with a date and time that works for Sunday night. And we're thinking 4-ish, are you thinking that's enough?
Yeah, I think 4 was.
Get too late, it kinda gets into sucking, people's plans, but okay.
And what would you want to be presented, just what we did for the proposed
Correct.
hearing?
Yeah. Well, I suppose if you have more information that we've decreased, like we make decisions on the 31st and it's after, yes, you'd be updating.
We can, yeah, but that's one of my questions, I've gotta get state forms done, and that's gonna be my priority.
That's
in
true,
October.
yeah, I
So
get it.
and that's Easter weekend in there, and I will not be in town, so
No.
don't know what I can have ready to present by
That's all right.
Tuesday the 7th. We at least have what's been done today. I can maybe get more done, I just don't know. So-
And we'll know by then though whether we've reduced anything more to it or whatever, so
Correct.
it doesn't mean you need to do a presentation.
I would suggest that we instead look at the week of the 13th. It's still the week before we would adopt the budget, and it's still,
Sure. Certainly can.
instead of putting Michelle under constraints.
Well, she's always under, she's gotten used to that, right?
So the only day my.
Tuesday the 14th at 4?
No. The only day open that week is the 13th.
Monday?
Yep. Every other day, there's already something we got going on with county business.
I can make it work.
Yeah.
4 o'clock. Congress.
There goes the doodle poll.
There goes Doodle Bowl, as you can tell, I'm half an hour late.
That's all right. Goodbye.
Doodle that one.
You did say you need to get moving.
I can make 4 o'clock the 13th work.
4 o'clock on the 13th?
Is that goes to you too? Alright, that's where we'll try and see if the chapel's available. If not, I guess this will be it.
Yep.
Alright, or downstairs or something. Got it. Okay.
Thank you
super.
guys.
Thank you. Number 11, any reports or information from the board?
Can we, well, maybe I just gonna put this in your ear.
Yeah?
So next Tuesday, because I don't wanna go through it again, Tuesday, you're gonna have to decide when the budget hearing is gonna be, what day and what time as well.
Yeah.
But we don't have to do it until Tuesday, but I think we
But
should,
we needed the decisions made next week on the 31st
correct,
to make that April 20th date,
yes, if yes,
that's where we go.
Yeah.
Okay.
that's, yep.
I don't know why anybody proposing something different than that wants to go to the last week or wait, no. I would think having the last week be the backup is kind of, if anything, to me is now some safest. Is that enough?
Yep, that'll be fine.
Item 11, any reports or information from the board?
Couple of quick things. Last week, little update from the ISAC conference. I did have my notes all with me. The ISAC group is doing a series of webinars, and training sessions for supervisors coming up. They hope to have them coming out this summer. Lester Township meeting last night. One of the trustees was there at our event that we did with educating folks on how rural property values are set. It was very humbling to sit there and watch this guy talk about how much he learned at that thing. It was really very impactful with the other folks that were there listening to them. I wanted to throw out a thank you to Tim Jameson again for the listing of the tax and TIF districts. That is very alarming in some aspects to see how many there's no sunset. And folks don't understand how much impact that has, not just on the county, but the cities. And you get some copy of that?
Yeah.
That is, I was really surprised by that.
Legislature's working on that too.
Yeah.
The sunset and stuff.
And then I had this in my notes, that Kathy brought it up. The Regional Transportation Authority was notified Thursday at our meeting. The DOT is holding this informational meeting, town hall in the Denver Library about proposed overpass for C-57 Cedar Wapsie Highway 63, April 15th, 5 p.m. We're supposed to be getting more official details on that here shortly, but that going from a concern less than a year ago to now it's on the radar and getting in front of people. I was kind of surprised it's happening that quick. So things are happening.
All I wanted to mention is, I guess, the 31st being our budget session, we'll see how long that's gonna be, but I thought in April we have those upcoming, possibly a closed session, but a session on the consolidated communications meeting, maybe in April. Also the Washburn Drainage District and that with the Kathy and Ben, that will be soon upcoming. I thought possibly asking the 4 action committees that we have for an update. So, that one, and yeah, so that's what I thought, because next week's gonna be busy with budgets, us doing new that, and see where we go, but that's gonna be upcoming and start getting us the schedule. Okay. Just so you find out. Yep, finalizing the budget. Gotcha. All right, motion for
I
adjournment.
got a question. Chris, on solid waste, what's happening with that? I've had a couple people ask me. They're ticked off about whatever they've heard, and I can't seem to find anything.
I've asked John to come to the board and do it, so I'll put that request in again, but I mean, it's,
Yeah.
the transition is ongoing. And so I think it's ultimately gonna save taxpayers dollars, especially in the management of how the cells are managed. One of the things that's really glaring is that there just wasn't an incentive to put the right amount of soil over top. So they're just putting way more, and that fills up the cells way faster, and means that we've got a bond sooner to build more. So that's one of the things that really jumped out at me, but I've asked John to come give an update, I'll ask him again.
Maybe April.
maybe.
So the Waste Commission has taken over control of the landfill now? And
Yeah,
Waste Tech is, okay,
Yeah, Waste Tech is phasing out,
okay.
and they've offered first hiring to Waste Tech employees, so they're going through that process right now.
All right. Excellent.
I asked for a motion in a second on adjournment,
Yeah.
just I didn't do it, is that?
So moved.
Second.
All right, I wasn't sure if anybody did it. That's all right.
You
All in
asked.
favor?
Somebody had a question. No.
Yeah, I interrupted
No, that's
again,
all right,
sorry.
okay. All in favor?
All right.
Aye.
Meeting is adjourned, thank you all.